What's up, chooms? Hope everything is Nova with y'all and that everybody is having a preem week. So, I don't know if I have missed something here, but there seems to have been an explosion of interest in the subject of oral minoxidil for hair loss. Many of you guys who have watched my videos know my opinion on oral minoxidil already. You know that I don't like it and that I don't think that it is safe. I can definitely, however, understand the appeal behind oral minoxidil. I mean, who wouldn't want to get their hair growth benefits from minoxidil while not having to deal with some of the downsides? Like the fact that it's a hassle while applying a topical solution, being that it's greasy and cosmetically displeasing. I mean, hair loss is a long-term battle after all, so if we're going to be in the good fight for the long haul, then it helps to have a treatment that is easy to adhere to, and what could be easier than just popping a pill every day, right? So oral minoxidil, also known as Lonatin, has been around for a while. It was first approved years before minoxidil as a last-ditch treatment for blood pressure, prescribed only in cases where more conventional blood pressure medications have failed for the patient. As such, its risks, which we'll get to later, are well documented, and therefore its off-label usage as a hair loss treatment has been controversial and obscure for many years now. So, wanting to know more about why there has been a sudden upsurge in interest from the hair loss community in oral minoxidil, I decided to do a bit of research, and I came across the most likely culprit in this recent oral minoxidil frenzy, and it is a very recent study from 2021, in fact, which makes the case that oral minoxidil, when taken at a small dose for hair loss, is a way to safely get the benefits of minoxidil while avoiding the hassle of using it topically. The article is titled "Safety of Low-Dose Oral Minoxidil for Hair Loss," a multi-center study of 1,404 patients, and it appears in the February 24th, 2021 issue of the Journal of the American Academy of Dermatology. It is from multiple medical centers: Spain, Brazil, Singapore, Australia, Italy, New York, and Florida, but surprisingly not from good Korea this time. So, in the introduction to the article, the authors note that minoxidil is a vasodilator approved by the FDA in 1979 for treating severe high blood pressure that doesn't respond to other drugs. So if you do have high blood pressure, oral minoxidil will never be your doctor's first choice because of all the risks associated with it. So the oral minoxidil dose for treating high blood pressure is 10 to 40 milligrams per day. The researchers say that oral minoxidil has dose-dependent predictable side effects at doses of 10 to 40 milligrams, including postural hypotension, fluid retention, tachycardia, pericarditis, and nausea. So just to clarify some of these medical terms, postural hypotension means your blood pressure drops when you stand up, possibly causing you to pass out. Fluid retention means your ankles swell up with fluid and you develop cankles, and tachycardia means your heart races too fast. Even more serious than that is pericarditis, which is when you get inflammation and fluid around your heart that compresses your heart so that it can't pump blood anymore, and obviously that can be fatal. Finally, it can also cause nausea, which isn't as serious but is still worth mentioning nevertheless. Right off the bat, you can tell these guys are minimizing the side effects. To justify this statement that the side effects are dose-dependent and predictable, they reference the package insert, which interestingly enough never says the side effects are dose-dependent or predictable. In fact, they fail to mention that oral minoxidil has a so-called black box warning reserved only for the most toxic drugs on the market. So I'm talking about things like chemotherapy drugs for cancer. Here it is if you want to take a look at it. So in it, they mention pericardial effusion, sometimes causing what's called tamponade, meaning the heart is being crushed by the fluid around it, and that of course can be fatal. They also don't mention that you can get angina pectoris, which is chest pain, or that oral minoxidil causes myocardial lesions, which means scar tissue in the heart, as seen in research with experimental animals. They say in the black box warning that, quote, Lonatin must be administered under close supervision, unquote, which is good advice, but that hasn't stopped the lab rat idiots from the hair loss forums from self-medicating, sadly. So some of the side effects from oral minoxidil, like the drop in blood pressure, might be predictable and dose-dependent, but there is no reason to believe that the life-threatening side effects are limited to just the high doses of the drugs and not the lower doses. There's literally no evidence that these more serious side effects are dose-related. So as you can see, these authors are already painting a relatively cheery picture of a dangerous drug like oral minoxidil, which I guess is why they were able to justify to themselves using oral minoxidil off-label in their patients. I mean, who knows? Maybe this is an attempt to make Lonatin a relevant drug again, since it is rarely prescribed even for hypertension these days, in light of the many safer blood pressure medications on the market, like beta blockers or ACE inhibitors. So to make their point, they then make out that the most frequent side effect of oral minoxidil is hypertrichosis, which means too much hair growth, usually in areas that you don't want hair to grow, like, the back or in the ass cheeks, or in the case of women, in the arms and legs. Hypertrichosis occurs in up to 80% of patients on oral minoxidil, so definitely this is a very common side effect. But fortunately for Johnson & Johnson, the current manufacturers of Rogaine, this very side effect is what eventually led us to having topical minoxidil so widely available to treat hair loss today. Topical minoxidil was first approved for treating hair loss in 1987. So even though there are several theories, its exact mechanism of action remains unknown to this day, though it does shorten the telogen resting phase and prolong the anagen growth phase of the hair cycle, and I talk more about this in my video on the hair growth cycle and shedding, which I'll go ahead and link below. The authors here state that low-dose oral minoxidil has been used off-label to treat alopecia, mostly because of convenience or to avoid local scalp irritation from topical minoxidil. They also note that published studies to date on the safety of low-dose oral minoxidil have been limited by a small number of subjects. So they set off to do a study looking at a larger number of patients to assess the safety of oral minoxidil. So I'm always in favor of people doing actual research. I mean, it sure is better than hearing anecdotal garbage on hair loss forums. So let's see what the results all of this research has yielded. So before we get to that though, in order to do this study, they contacted dermatologists at 10 medical centers from 6 different countries and got records on patients who had been treated off-label with low-dose oral minoxidil for at least 3 months for hair loss of any kind. So it was like the United Nations for hair loss research, which is pretty cool if you think about it. But anyways, for some reason, they decided not to look at how well oral minoxidil worked. They were only interested in the safety data. So they were looking purely at side effects, not efficacy. Notice, however, that this is not a prospective randomized controlled study, which would be the highest quality study. Rather, this is a retrospective study, which means that the researchers just gathered data that was already available and wasn't part of a pre-planned study and wasn't gathered in a strict manner. So these doctors were all basically just buddies prescribing oral minoxidil off-label, so obviously they were already biased towards using the drug in this capacity, which in a scientific study is not very good because you want to avoid all bias. Other problems with a retrospective study, are that the frequency of follow-up may be different at different medical centers. So for example, maybe in New York they check the patients for side effects every week, while in Brazil maybe they check them only once every 3 months. So the quality of the follow-up data may be different at the different centers. Like in New York, they would be more likely to detect side effects than in Brazil if the follow-up was different, as I just described. All these problems are voided with prospective studies, though, where the study is planned out ahead of time. The treatment is randomized, so there is no bias, and the follow-up is the same in all the centers. So for these reasons, retrospective studies just aren't as high quality as prospective studies, but unfortunately, if you are reading the hair loss forums, you won't bother to make these distinctions if the study results tell you something you want to hear, and that is basically what hair loss forums are like these days. Lots of confirmation bias and very little science mixed in with a healthy dose of fear-mongering and hysteria about conventional treatments, as if somehow a black box warning blood pressure medication like oral minoxidil or some abandoned research chemical like RU5841 are safer than an FDA-approved medication like finasteride, and that is what the majority of these morons believe, though, sadly. So getting back to the subject, though, this kind of study design is inherently pretty biased, but let's go ahead and look at the results anyways. They gathered together information on 1,404 patients, of which 943 were women and 461 were men. It's interesting that the majority were women, even though the most common indication for treatment was androgenic alopecia in 82% of all the patients. The rest had causes of hair loss other than androgenic alopecia, but that's fine because, minoxidil, it's not hormonal. It can work for other causes of hair loss as well. The average age was 43, with a range from 8 years old, which is pretty young and also pretty sad, as it's hard to imagine what it's like dealing with hair loss as a child. And the oldest patients were 86 years old, so this study has a very wide age range at least. So In Table 1, they summarize all the patient data. The doses of oral minoxidil used were all over the place. They were as low as 0.03 milligrams up to 15 milligrams per day, which is actually the dose prescribed for hypertension. So even though this study is supposedly about low-dose oral minoxidil, not every patient here is on an actual low dose of oral minoxidil. Most of the patients did not even receive a steady dose. In fact, 1,065 of the 1,404 received multiple different doses, which makes you wonder how can we even pin down a safe dosage when the doses weren't standardized across the entire patient population. The closest we can get to a standardized dose across the patient population is an average of 1.63 milligrams per day, though again, the dosing range was very, very wide. It's also interesting that 25% of these patients were also on topical minoxidil as well, which makes you wonder what was the point of taking both of them. I mean, they also never mentioned if any of these people were taking finasteride or any other treatment, which makes analyzing side effects pretty difficult if they're on multiple drugs. So since this study is more about safety than efficacy, what were the side effects? Well, here they are in Table 2, as you can see here, and if this looks pretty confusing, that is because it is confusing, so let's go ahead and try to break this down. First of all, they don't even mention the most frequent side effect in this table, which was hypertrichosis, which again is the growth of hair in unwanted places of the body, and that occurred in 374 patients, which was 15% of all the patients. 14 patients, which was 0.5% of the patient population, discontinued the minoxidil due to this side effect. This table just looks at systemic side effects, and they didn't consider hypertrichosis as a systemic side effect, which is interesting because, it clearly is. I mean, we are talking about an oral drug here, so shouldn't every side effect be considered a systemic side effect? I mean, the drug is not being applied topically. It's being taken by mouth and being swallowed, so I think so. But anyways, systemic side effects occurred in 135 patients, which was 5.5% of the total number of patients, and 29 patients had to stop treatment, which was 1.2% of the total number of patients. The most common side effects in descending order were lightheadedness, edema, which means fluid retention, rapid heart rate, headache, swelling of the eyeballs, and insomnia. About 1% had more than one side effect, and the most common second side effect was hypertrichosis, which in light of all the other discovered side effects now seems pretty trivial by comparison. So the researchers also claimed there were, quote, no life-threatening side effects, unquote, which I guess they mean to say that nobody died in the study, so, okay, cool story, bro. The most common side effects that caused people to stop the drug, though, were hypertrichosis, fluid retention, tachycardia, lightheadedness, and headaches. This is shown in this figure right here. They found no association between patient weight and adverse effects, and people who used topical minoxidil in addition to oral had no increased risk of side effects, but we wouldn't expect topical minoxidil to add to the side effects anyways, being that it is not systemically absorbed to a point where it is clinically significant, hence why it is an over-the-counter drug and has been for over a decade now. A few patients, 5% in fact, took the oral minoxidil every other day, and there was a lower risk of hypertrichosis in those patients. Also, if you took a compounded version of oral minoxidil, there was a slightly higher risk of hypertrichosis than if you took the commercially available Lonatin. This may be because the compounded drug may actually have more of the drug in it than what is advertised, depending on the quality of the compounding pharmacy. I mean, since this is an off-label drug, a lot of people have to get it compounded to get a lower dose, and chances are the only pharmacies that would be willing to compound such a drug are the really shady gray market pharmacies that are located in the shadier parts of town, right next to the massage parlors and pawn shops. And this is another difference between a retrospective study and a prospective study, because in a prospective study, the study drug would be uniformly produced by a legitimate pharmacy, and the dosing would be standardized to get consistent and reliable results. So getting back to the side effects from the study, they found that the risk of hypertrichosis was dose-related. However, the other side effects did not seem to be dose-related, despite the authors saying in their introduction that oral minoxidil side effects are dose-dependent and predictable. So that seems like a little bit of a contradiction, wouldn't you guys say? But in their later discussion, the authors also note that this is the largest study of the safety of low-dose oral minoxidil that exists currently. They note that earlier studies reported a 20 to 24 incidence of hypertrichosis with more serious side effects like postural hypotension, tachycardia, and lower leg edema in 1 to 3% of patients, but there were no life-threatening side effects reported in earlier studies of low-dose oral minoxidil. Overall, in the current study, there were side effects in 21% of patients, which is fairly high, and there were systemic side effects in 5.5% of patients. And for comparison, remember that topical minoxidil systemic side effects are extremely rare, and that's based on years of clinical research and consumer use in millions of patients across the world. Also, hypertrichosis on oral minoxidil is the most frequent side effect, but with topical minoxidil, all the hypertrichosis is just local, namely on your scalp, where it isn't a side effect. It's what you want the drug to do. Topical minoxidil works locally, and maybe that is why people have had success using the drug for some off-label purposes, such as growing thicker beards, but the point is that it won't have the same systemic effects as oral minoxidil. So the researchers then mentioned that pericardial effusions, which is a fluid around the heart, occurs in 3% of patients on higher dose oral minoxidil for treatment of high blood pressure. Now, this already sounds bad enough as it is, but the truth is that it is actually even higher than this. In a study of 1,869 patients on the standard dose of oral minoxidil, which again is between 10 to 40 milligrams per day, 5% of patients developed this type of complication. They point out that many of these patients with this complication did have some underlying disease like lupus or kidney disease, and this may have played a role in developing this side effect, but the truth is we don't know. And although this problem hasn't been reported with lower dose oral minoxidil yet, it may only be a matter of time before it does happen, and when it does, I don't want to hear that the person who died did so after following the recommendation of some idiot on YouTube who hypes up oral minoxidil. I mean, it may be that the young age of people treated with oral minoxidil for hair loss protects them somewhat from these cardiac effects just through the merits of being young and healthy, but it's not clear that the risk of these life-threatening cardiac problems is indeed zero. Just because it didn't happen in this study to the groups of younger people doesn't mean that it will never happen. And even if the risk is low, we're not talking about a side effect that is just a mere nuisance, like lower libido or something. We're talking about a side effect which can literally kill you. So if you have a 5% chance of some of these life-threatening side effects, do you really think that just lowering the dose is going to eliminate them completely 100%? Even these researchers are not too confident in the safety of the drug, since they warn that you shouldn't even use low-dose oral minoxidil if there's a history of cardiac or kidney disease. There are plenty of people with asymptomatic heart disease and kidney disease. I mean, how many times have you heard of a supposedly perfectly healthy person who suddenly drops dead from a heart attack? A famous example of this is Jim Fixx, who was a professional marathon runner and author of best-selling books on running, someone who by every impression seemed to have exceptional cardiovascular health, but he dropped dead suddenly while running at the age of 52 due to unsuspected heart disease. And this doesn't just happen to middle-aged or older people. There are numerous examples of even high school athletes experiencing sudden cardiac death. Even when I was in high school back in the 90s, it happened to another student that I knew. The point is, though, is that cardiovascular disease is the most common cause of death in the entire world. And about 50% of the time when someone dies of a heart attack, there was no warning beforehand. So don't assume that you have perfectly normal heart health just because you feel good or you're in good shape. And by that same token, don't assume you are safe from the cardiovascular risk of oral minoxidil just because you feel okay taking it. And I would also further add that by saying that although pericardial effusions can be life-threatening, they can also be asymptomatic as well, or they can cause leg edema, which of course was seen as a complication of this study. The point is, though, is that if you want to exclude pericardial effusions as a complication, you actually have to look for them, meaning you have to have something like a cardiac ultrasound, and it's pretty clear from the methodology of this particular study that they didn't do that, so we can't exclude that some of the patients in this study actually may have had pericardial effusions. So it would be like doing a study on hair loss or the hair loss treatment's efficacy and not actually looking at the hair at all. So you might say, well, if it didn't cause life-threatening complications, I mean, so what? Well, I don't know about you, but I wouldn't be happy if a hair loss treatment that I could just as well be using safely as a topical was causing fluid buildup around my heart. I mean, that seems like too big of a risk factor if you ask me. And people make idiotic decisions about their health all the time. I mean, just look at how many people are smoking and drinking out there. But that doesn't mean I'm going to promote it here on my channel. So anyways, the researchers then go on to discuss what to do if side effects do occur, as shown in this table here. One of the strategies they note is that if the patient gets tachycardia, meaning rapid heart rate, they then will refer them to a cardiologist. And that's great. Take a treatment for hair loss and end up seeing a cardiologist. That's like saying, yeah, go ahead, have a bunch of unprotected sex, and then just go see an infectious disease doctor if you happen to get HIV. They then note that some of the side effects might be due to other drugs the patients were taking. I mean, they mentioned that 13 of the 43 patients who complained of lightheadedness were also taking spironolactone, which is a diuretic and a blood pressure medication, although at larger doses it also acts acts as an anti-androgen. Unfortunately, with this kind of study design, we don't know what other drugs the patients were on that might have worsened or actually prevented minoxidil side effects, so this is yet another limitation of the study. Based on the data we have from the study, the researchers recommend starting at 0.5 milligrams per day and increasing by 0.25 milligrams every 3 months up to a maximum of 2.5 milligrams per day for females. As for men, they recommended starting at 2.5 milligrams per day and increasing the dose by 1.25 milligrams every 3 months up to a maximum of 5 milligrams per day. They don't explain their justification of different doses for men and women, but I imagine it may have something to do with hypertrichosis, hence why topical minoxidil for women also comes in a smaller 2% concentration compared to the 5%, which is typically prescribed to men. They also recommend lower doses for children under the age of 12 who presumably are being treated for hair loss from disorders other than androgenic alopecia. However, I'm sure the number of children treated with minoxidil is very low, and I would be even more worried about treating children with oral minoxidil given how fragile children are and the fact that they are still growing. And, even just the fact that they recommend a black box warning drug like minoxidil to children as young as 12 seems pretty reptilian to me. I mean, it really makes me think that these guys are pretty cavalier about using this drug, if they even recommend it to young children like this. So, like topical minoxidil, oral minoxidil needs to be used indefinitely because if you stop using it, you will lose the gains you made on the treatment. They emphasize that this is still an off-label use of the drug and the patient should be fully informed of the risk, although if one of them was informed me, I'd probably insist on a second opinion. They also note that their study is limited by being a retrospective study in design and that it lacked a control group and that it also lacked detailed information about the patient, such as other drugs they were on or other diseases they may have had. In addition to these limitations, I would further add that the study is a little strange because there is no outcome data on the efficacy of these doses. I mean, how well does it work at these low doses compared to topical minoxidil? Is it even worth the risk? It is impossible to say for sure based on this study, which is a disappointment since oftentimes one of the allures of oral minoxidil is the notion that it may work better than topical minoxidil, but who knows if that would apply with the doses they used in this study. I mean, they used doses as low as 0.03 milligrams per day, so that may as well just be a homeopathic dose for all we know. Point is, though, is that there is no way we can determine the efficacy of low-dose oral minoxidil based on this study. So even if somehow you are convinced of the drug's safety profile, there is no way to determine if it is more effective than topical minoxidil, at least at these doses used in this study. So I know some of my viewers have been telling me things like, "But Kevin, I heard this one guy tell me that oral minoxidil is safe." But sorry to say it, but nevertheless, I have to remain hesitant to recommend this treatment. Now, I have nothing against dermatologists. I happen to know some dermatologists, but I'm still not sure it's a great idea to have a bunch of dermatologists whose knowledge of internal medicine is just skin deep start prescribing a drug that real internal medicine specialists consider a last resort and which also has a black box warning on its package insert, which is only reserved for the most dangerous types of drugs on the market. Typically not the type of drugs you'd see used for a cosmetic issue like hair loss. So if you go on oral minoxidil and then develop a pericardial effusion, I think a dermatologist is probably the last doctor on the planet you want to see to diagnose or treat that. Remember, dermatologists do not go through the same training pathway as internal medicine doctors. They generally don't know how to read electrocardiograms, for example, so they won't be able to diagnose cardiovascular issues themselves. If you actually do go to a cardiologist and tell them you want to start oral minoxidil for hair loss, they'll rightly tell you to fuck off because the last thing they want is litigation because some idiot watched a video on YouTube about oral minoxidil and decided it was worth risking a heart attack over. Cardiologists would never prescribe a dangerous drug like oral minoxidil for hair loss, and I am not willing to recommend a drug that has a risk of serious side effects just for convenience's sake, especially since we have no reason to think it works any better than topical minoxidil, and of course topical minoxidil has close to zero systemic side effects and has a much better safety profile and better safety data accumulated over many years compared with oral minoxidil, which is rarely used for anything at all these days. I mean, not even for high blood pressure, which the drug was originally designed for. So I know that at the end of the day, some people are going to do what they want with their own bodies, but I don't want any part in that. What you do with your medical decisions is ultimately between you and your doctor. And sure, maybe there are some people out there who have benefited from oral minoxidil in treating hair loss. However, I personally cannot in good faith faith recommend this treatment, because I don't think the benefits outweigh the risk, and I certainly don't think this one crappy retrospective study dismantles any of the very real concerns associated with oral minoxidil's risk. So please guys, if you want to use minoxidil, just use the clinically proven topical solution. I know not everybody is a responder to topical minoxidil, but even in that case, there are things you can do to bypass that, such as mixing minoxidil with 0.1% tretinoin to increase the sulfotransferase enzyme on the scalp. And failing that, you can even try 10 to 15% minoxidil, which isn't a good choice for people who respond well to 5% minoxidil already, but it has been shown to work in non-responders to 5% minoxidil. And I talk about this in depth in my video comparing 5% minoxidil to 10 and 15% minoxidil. I'll go ahead and link that below in case you guys haven't seen that video yet. And also another thing that I think is worth pointing out about the sulfotransferase enzyme is that genetic variants of the enzyme may predict the response to oral minoxidil. So if you don't get results from topical minoxidil, you may not necessarily get results from oral minoxidil either. There is not enough data to confirm that oral minoxidil is a viable alternative to non-responders of topical minoxidil. So keep that in mind as well before considering oral minoxidil. Truth is though, most people who think minoxidil isn't working for them are people who don't understand that these drugs will more often than not cause maintenance rather than giving them direct regrowth, or they'll misinterpret something like a shed as a sign that the drug is not working. So the chances that minoxidil will work for you are very good. And even if it doesn't, chances are finasteride will probably still work just fine as a standalone treatment, and you may not even ever have to add anything else to your hair loss stack. But just remember to be patient regardless of what type of hair loss treatment you're using. I mean, it can take up to a year before you see the full results of any hair loss treatment. And with that, I think I'm going to go ahead and get the COVID vaccine now, and then I'm going to go ahead and brag about it to trigger all the maskless bone broth slurping Karens at Whole Foods. Take care.